There is nothing wrong with plastic surgery, but an uptick in surgeries among teens is alarming. We dig into why coming up. There's been an increase in teens getting plastic surgery. Of course, social media is a big reason why. So what can you do as a parent to build more confidence in your teen? We talk to an expert next. Supermodel Bella Hadid recently made headlines not for a recent ad campaign or high fashion runway show, but for expressing regret for a nose job she had at 14. Of course, she's not the only celeb to go under the knife. And so we have LA plastic surgeon Dr. Deepak Dugar joining us with more on this rising trend of teenage plastic surgery. So welcome to the show. How you doing?
I'm doing fantastic. Thank you so much for having me. Good morning, everyone.
Yeah, good morning to you. So it seems shocking, but you say plastic surgery has been on a steady rise for many years among teenagers. Is this true? And what do you think is causing this trend?
Yeah, I think it's definitely true. I think over the years, we're noticing that self-perceptions of ourselves are getting worse and worse. And I think it's permeating younger and younger every day by social media. There's no question that the social media presence has really taken a toll on our youth. And I think that we have to do something and talk about the conversation that nobody else is having with them at school and around their peers.
Okay, and you know, we just mentioned that Bella Hadid had the nose job and she expressed regrets. Is this something that you're seeing a lot, kids getting nose jobs? What are some of the other popular procedures, and what do you think about her regretting that move?
Well, the number one surgical plastic surgery procedure for people between the age of 13 to 20 is nose jobs. Number two is breast augmentation. So those are the two main things that people are getting done outside of teeth work, so orthodontics or dental work.
Right.
So with breast and nose surgeries, the number one and two things I always talk to patients and parents about is parents, do not put the pressures of your own history on your kids. Just because you were bullied as a kid, just because you have negative emotions about your own nose when you were a kid, doesn't mean your own child will. Let your child decide on their own if this is something that they want to do. And if they do, then let them talk to a board certified surgeon who can guide them on their options. Number two, I always tell people to wait at least 6 months. It's very important to give yourself 6 to 12 months once you think you want something done to make sure you're not getting a permanent procedure based on a temporary emotion.
Now, I read something that you have in the past convinced people not to go under the knife. Is that true?
Yeah, all the time. I convince people not to do surgery left and right. And the reason is not everyone needs surgery. Sometimes it seems like the easy fix, but sometimes the deeper work is the conversation that you have to have with yourself. And that's why I don't offer surgery to everyone. Only people who A, are mentally fit, emotionally fit, and also anatomically are the right fit for surgery. And that's how I go to bed at night, knowing that I'm only doing surgery on patients that are properly fit for it.
Okay, now you have a new book coming out that kind of tackles this root cause of perhaps why some people want to go under the knife. Can you tell us a little bit about this book, the title first, and why you wanted to write it?
Yes. So this book called BeYouTiful, Flip the Script and Celebrate Your True Beauty is a passion project of mine. I've interviewed over 10,000 patients over the past 7 years. And what we've learned from them is that more people are focused on how they look rather than how they feel. And I want to flip that script and remind people how important it is to focus on feeling beautiful and not just looking beautiful. I'll give you some startling statistics from the book just to give you a snippet.
Please.
Did you know 60% of girls sometimes will avoid classroom discussion or avoid activities at school because of how they feel they look? And up to 20% of girls will skip school completely if they feel they look unattractive. Wow. Another study showed that some girls who focus on how fat they are will grade lower on test scores than other girls who don't worry about this. So there's this whole endemic that's happening with us and how we self-deprecate instead of self-appreciate. And I want to teach everyone, to remind everyone how we can get back to that appreciative thought.
Okay, so how is the book set up? Do you share some of those statistics? How are the chapters? What do you dive into in each of the chapters? What are some of the titles of those chapters? Walk us through it, the layout.
Yes. So the biggest thing about the book is that I really wanted to give people as much information statistically and data wise, because I think that that's where my opinion is less important as the actual data out there. So we dive into social media, we dive into the advertising history from the 16th, 17th century all the way to now, and how it always permeates financially and who's gaining at the end of these things, whether it's a plastic surgeon like myself, or whether it's a beauty campaign like Dove, or whether it's someone like a makeup beauty campaign like Maybelline. We're always looking at where you're being sold and how you're being sold. We also talk about strategies that you can take on to take away some of these negative toxic inputs that are coming into your life every single day. Most of it's subconsciously, whether it's your friends, your family, and how you can mute them either on social media or in real life, and how you can make yourself more appreciative every day of what you have. We break it down chapter by chapter. It's a book of 11 chapters. And the last chapter, my favorite one, is Can the Tide Be Turned? We tell a lot of celebrity stories, a lot of celebrity interviews, where we break down what their concerns are. And how we are slowly turning the tide, and how you can be part of that journey.
Wow, sounds like a great read. Real quick, why did you decide to become a plastic surgeon?
I became a plastic surgeon because I wanted to help people. I felt like it was such an empowering thing that in a 2 to 3 hour surgery, I'm able to change someone's life. And I see that on a daily basis. But just like makeup, just like dieting, these things can be abused and can be used for the wrong reasons. And so that's where I am trying to be the most ethical version of myself and not give surgery as an option for everyone, but only those who really need it.
Okay, perfect. Well, thanks so much for joining us. It seems like it'll be a good read for anyone, right? Parents, for young people. Let me give your website so people can get their hands on your book.
Absolutely.
Oh, thanks so much for joining us. For more on his book, you can visit this website, drdugar.com.